Hello and welcome to this lesson, Primary Biliary Cirrhosis. Primary biliary cirrhosis is one of the leading causes of liver cirrhosis, especially in women. And in this video, we are going to talk about the manifestations and symptoms and treatment of primary biliary cirrhosis. And basically everything you need about this disease will be in this video. So let's start. So what is primary biliary cirrhosis? Primary biliary cirrhosis is due to the fact that we have inflammatory destruction of intrahepatic bile ducts, and it is usually affecting a small and medium-sized intrahepatic bile ducts. So if you pay attention to this picture, we have a biliary system that starts inside the liver, which we call intrahepatic bile ducts, and the job of these intrahepatic bile ducts is to transport the bile from the liver to the gallbladder, and after that the extrahepatic bile ducts are going to excrete the bile through the extrahepatic bile duct into the gastrointestinal tract. So in case of primary biliary cirrhosis, we are only affecting intrahepatic bile ducts, and extrahepatic bile ducts are going to be spared. This is in contrast with primary sclerosing cholangitis, which both intrahepatic and extrahepatic bile ducts are going to be affected. So this is the first difference between primary biliary cirrhosis and primary sclerosing cholangitis. So the second point that you have to know for your board examination is that first of all, trigger is unknown, but we have a T lymphocyte mediated attack against intrahepatic bile ducts. And when we have this pathology and we do not enter the bile through the biliary system to the gastrointestinal tract, we are going to have some problems. So problem is that first of all, we are going to have malabsorption of fat-soluble vitamins, because for digestion of fat-soluble vitamins, we need bile in order to saponification of the fat. And another point is that the cholesterol and bile are going to leak from biliary tree to the blood, which gives us jaundice due to increased bilirubin, leakage of bilirubin from biliary system to the blood, and we also have leakage of cholesterol from biliary system to the blood. So the patient will have signs and manifestation of hypercholesterolemia as well. So now let's talk about presentations of primary biliary cirrhosis. First of all, note that this disease affects women more than men, because this is an autoimmune, almost an autoimmune disease, and the mean age of onset is 35 years old. So this is basically a middle-aged woman who is presented to the clinician with signs and symptoms of primary biliary cirrhosis. And this is unlike primary sclerosing cholangitis, because that's also a very similar disease. It affects extrahepatic and intrahepatic biliary system, but in the primary sclerosing cholangitis, men are affected more than women. So this is the very good differentiating point that you can see on the board examination. And signs are, first of all, fatigue. Fatigue is one of the most important signs of primary biliary cirrhosis, and this is not a usual fatigue. This is not a very slightly malaised patient. You are expected to see an extreme fatigue. For example, they might describe that after an 8 hours of sleep, they are unable to get up from the bed, and they also will have progressive jaundice later in the course of disease. Because of bile leakage, they will have pruritus, and also because of the fact that the bile is necessary for absorption of fat-soluble vitamins, and in this disease we have signs and symptoms of biliary blockage. The patient will have fat-soluble vitamin deficiencies. So what are the fat-soluble vitamins? We have vitamin A. Lack of vitamin A will lead to blindness. We have vitamin D. So vitamin D is important for bone restoration. So when patients will have vitamin D deficiency, they will have hepatic osteodystrophy and osteoporosis, and they are at risk for bone fractures. We have vitamin E, which deficiency will lead to dermatitis, and also we have vitamin K deficiency in case of primary biliary cirrhosis, which leads to bleeding and easy bruising in case of primary biliary cirrhosis. Another symptom is that the patient might have hepatosplenomegaly, and this is usually a complication of portal hypertension and liver cirrhosis, and happens later in the course of the disease. But note that before the patient starts to become symptomatic, actually they can be asymptomatic for years. So a patient might have primary biliary cirrhosis and be normal for years and years, and suddenly they develop signs and symptoms of liver cirrhosis or biliary blockage. Another manifestation is portal hypertension, and this is due to the fact that most of the patients who are untreated in case of primary biliary cirrhosis, it leads to liver cirrhosis. Also, patient may experience autonomic dysfunctions. For example, the patient might have orthostatic hypotension, and again, due to the fact that we have vitamin D deficiency, older women usually develop osteoporosis due to the fact that they cannot absorb enough amount of vitamin D. Another manifestation is hypercholesterolemia. So we talked about the fact that cholesterol is going to leak from bile to the blood. So the cholesterol of this group of patients are going to be elevated. And the first clinical sign is xanthoma and xanthelasma. You can see it here in this picture, a white plaque that is around the eye. This is called xanthelasma. And another point about this disease is that primary biliary cirrhosis is associated with other autoimmune diseases like Sjogren's syndrome, like scleroderma and thyroid diseases. So you're expected to see a patient with signs and symptoms of primary biliary cirrhosis and Sjogren's syndrome, dry mouth, dry eye, scleroderma, or thyroid disease. Usually they have hypothyroidism when thyroid diseases are associated with primary biliary cirrhosis. So what are the lab results in case of primary biliary cirrhosis? Note that in early course of the disease, the CBC can be normal. So you are not expected to see any clinical manifestation or lab results when we are in early course of the disease. But when the disease starts to manifest itself, it manifests itself as cholestasis. So you will see elevated alkaline phosphatase. This is usually the sign that the biliary tree is involved in the disease. You will see mild elevation in ALT and AST. And also very specific for this disease is an antibody, which is anti-mitochondrial antibody, which will be positive if patient is having primary biliary cirrhosis. And diagnosis is made based on cholestasis, increased alkaline phosphatase, and also positive anti-mitochondrial antibody. But if anti-mitochondrial antibody is negative, it does not mean that the patient does not have primary biliary cirrhosis. So you will have to do liver biopsy of intrahepatic bile duct in order to diagnose and see biliary cirrhosis. And also note that liver biopsy also helps the staging of the disease, and it is gold standard, but this is not a test that you always do. So if the AMA is positive, this is just enough to make the diagnosis of primary biliary cirrhosis. Now, what are the differentials? What other disease can mimic signs and symptoms of primary biliary cirrhosis? So in this disease, we have biliary blockage. So any disease that can cause biliary blockage can mimic signs and symptoms of primary biliary cirrhosis. So what are those diseases? For example, biliary stone, biliary stricture, carcinoma of bile duct, or primary sclerosing cholangitis. All of these diseases cause biliary blockage and mimic the signs and symptoms of primary biliary cirrhosis. But if you do the biopsy, you will see granulomatous infiltration of the bile duct, and this is very important for you to know, because unlike primary sclerosing cholangitis, which is not a granulomatous disease, in primary biliary cirrhosis, you will see granulomatous infiltration of the bile duct. And this is a picture of a granuloma that happened in the portal tree. So now let's talk about treatment of primary biliary cirrhosis. First of all, note that one of the main complaints of patient is pruritus due to the fact that they have bilirubin leakage from bile to the blood. So this causes pruritus. So we give cholestyramine. Cholestyramine is an oral drug. We give it to the patient, usually 1 gram to 2 gram every day, and it is quite helpful in case of pruritus. We have other options. We can give the patient rifampicin, ondansetron, or opioid antagonist. These are other options in case cholestyramine cannot be tolerated, but they are not as effective as cholestyramine. So fat soluble vitamins should be replaced in case of primary biliary cirrhosis. Again, we have fat soluble vitamin deficiency due to the bile blockage. So for example, this group of patients are required to have vitamin K monthly injection in order to have their vitamin K to be replaced. And other vitamins should be replaced, other fat soluble vitamins should be replaced as well. And another treatment for primary biliary cirrhosis is ursodeoxycholic acid, and this is actually a very effective drug because it slows down the progression of the disease. It can even prevent progression of primary biliary cirrhosis to the liver cirrhosis, and also it can be used during the pregnancy. The problem is that it can cause weight gain and puts the patient in risk of diabetes mellitus. And another important drug for patients to be prescribed is biphosphonate. This is due to the fact that, again, these group of patients are having vitamin D deficiency and hepatic osteodystrophy. So biphosphonate helps to decrease risk of osteoporosis and fractures. And the definite treatment is liver transplantation. Of course, there is no guarantee because, again, the patient might develop primary biliary cirrhosis after liver transplantation, but this is a definitive treatment. We are done with primary biliary cirrhosis. See you in the next video.